This conference will now be recorded.
Will join us in the next couple of minutes, but I'm going to begin. Good afternoon, and thank you for taking some time this afternoon to join our webinar. My name is Susan Varden, and I'm the National Director of Right to Play Canada. I want to start by saying I hope you are all healthy and safe and staying home where possible. For any of you who yourselves or your loved ones are on the front lines as healthcare workers or providing other essential services, thank you for the role you're playing in keeping everyone safe. I'm currently in Toronto, speaking with you from my home, where I'm self-isolating with my family. I am pleased to be joined on this call by colleagues who are going to share with you what the reality is on the ground where Right to Play has programming and the evolving responses from our amazing teams in the field. It is my pleasure to introduce our three esteemed panelists to you. We've got Kevin Frey, the Chief Executive Officer of Right to Play, Lawrence Ofei, who is a training officer in our Ghana operation, and Mallory Hilkewich, our Acting Director of Canadian Programs. Before we jump into the conversation, we'd like to start with a land acknowledgement and a quick stretch that will be led by Mallory. Over to you.
Thanks, Susan. Good afternoon, good morning. I'm not sure all the different time zones people might be calling in from. So I'll kick us off with a land acknowledgement. I too am speaking to you from my home. And my home is on the traditional territory of the Wendat, the Anishinaabe, the Haudenosaunee, and the Mississaugas of New Credit First Nation. Today, this land is home to many First Nations, Métis, and Inuit peoples. I've been calling this territory home for the past 5 years, and I would like to extend my gratitude for their hospitality, particularly at this time as we come together to support one another through this crisis and act with great care for the most vulnerable community members in our homes and in the territories that we live and work in. Because I imagine many of you, like me, have been sitting at a desk and maybe not a cushy office desk, I want to do a little bit of a stretch with us this morning. So I'll invite you all, if you're sitting, to sit with a straight back. I'll do my best to role model what I'm asking. Straight back, not against your chair. We're going to do a seated mountain pose, so it's super simple and should be accessible for everybody. So sit straight back, shoulders shrugged down, and have your shoulders above your hips and your knees above your ankles and your feet flat on the ground. And I'll just ask you to do some breathing in and out with me in this pose. So we'll breathe in for 4 and out for 4. And again, this is called the seated mountain pose. So I'll have you go in, 2, 4, and out. And one more time, in, 4, and out. Okay, super simple. At Right to Play, we like to stretch, we want to be energized, but I also know that we're all coping and working in different spaces, and so hopefully you can start the webinar feeling refreshed, and thank you all for being with us today.
Thanks, Mallory. We all needed that. The COVID-19 pandemic is having a tremendous impact on all of us, whether it means working from home, taking a wide berth of anyone we pass on the street if we're out for a walk, and economically, none of us really know what the future holds. Given all of this change, we wanted to take the opportunity to invite you, our donors, into a conversation about what the impact of COVID-19 is having on the communities and specifically the young people we work with, how it is impacting our programs, and how we're helping to address the crisis. We're going to chat for about 30 minutes, and then there'll be some time at the end for you to ask our panelists any questions you may still have after the discussion. Kevin, I'd like to start with you by asking you to share what you're hearing in terms of the impact of this crisis in the places we work around the world.
Thanks, Susan, and thanks everyone for joining us today. As many of you know, Right to Play works in 15 countries, so we work across East and West Africa, work in the Middle East, in Central Asia, in Southeast Asia. We're in 85 Indigenous communities here in Canada, and in 52 refugee camps across Africa, the Middle East, and Asia. And we reach over 2 million children every year in those locations. While the situation is different in every one of those countries, there are definitely some commonalities. In all countries except one, Burundi, where we work, there is a national lockdown of varying degrees. And again, in every country where we work, again, except Burundi, children are out of school. The children in our programs live in precarious contexts. And there really are three characteristics that I think best represent those contexts in this crisis. First is insufficient healthcare. I was reading in the New York Times over the weekend that in fact 10 African countries have no ventilators at all. And for many folks in rural communities, there is no access to healthcare. One of the countries where we have very large operations, we have a big education program, a big child protection program, the country of Mali. It has 20 million people and it has 3 ventilators, just to give you a bit of a sense of scale to the insufficiency of healthcare. The second is very high population densities. So lots of people living in very tiny spaces. In urban slums like Jamestown in Ghana, and we'll hear more from Lawrence about Ghana, and in the refugee camps where we work. These are perfect conditions for a virus like corona to spread. As the virus starts to arrive in these communities, they really have the potential to decimate some of these camps and the communities. And then I think that the third characteristic that's so important to come to terms with in the places where we work are the economic realities that make isolation and quarantine practically impossible, certainly in the medium to long term. The world's poorest don't have savings. They have to work every day to earn the money to buy the food they're going to eat the next day. And they don't have anywhere to store their food. They have to go to the market every single day. I think, and I was also actually watching a really interesting program on CNN with Bill Gates yesterday, and he was definitive on this as well, that once this pandemic's behind us, the communities where Right to Play works in some of the poorest parts of the world will, without question, have been some of the hardest hit on the planet, which is, of course, sadly the case in many crises because it is the poorest who are most affected.
Thanks, Kevin. It's really, really interesting. Lawrence, thank you for joining us remotely all the way from Ghana. Our listeners in Canada will be keen to understand what your reality is right now in Ghana and how life is changing in Ghana since the arrival of this pandemic. Over to you.
Yes, Susan, thank you. And I'm happy to be part of this call. In Ghana, it was business as usual until the 12th of March when we recorded our first case. Government immediately responded to the issues and then it came up with some stringent measures to curb the spread. Particularly, we're looking at some partial lockdown in some of the cities. We are looking at controlling the social gatherings to up to 25, closing all schools across the country, and limiting church and mosque activities, in addition to implementing some World Health Organization safety protocols. Now, to put it into perspective, in Ghana, we have about 30 million people across 16 regions. And currently, we have recorded almost up to 2,000, though this figure is disputed, 2,000 cases of COVID-19. And with the nature of our environment, the population, the locate, how people really live, and the fact that the cases, the situations in our health sector, just as many other sectors where we are looking at the ratio of doctor to patient, availability of hospitals, with these things, it is expected that in the coming weeks, it is going to increase exponentially. Now, one of the key challenges COVID-19 has brought to us is basically one is the misinformation, particularly in rural Ghana, where they have challenges accessing radio, internet, and then reliable electricity. And so they have to rely on the myths and the social media issues that are coming. For instance, the very popular one is the fact that the more you drink alcohol, you are going to be able to curb or just save yourself from the infection. Another aspect is the fact that government, in place of closing down schools, instituted or put in place some virtual learning. But then again, the challenge is for the most people, the millions of children who are in the rural Ghana, where they don't have access. Most of them, you don't find television in homes. They don't have access to electricity, internet to be able to access these online programs. In place of that, families are taking advantage of this to rather put their children to work, sending them to their places of work or engaging them in all manner of chores that really are putting the children not really enjoying the kind of alternative learning they should be having. And this is the situation we have in Ghana. Right to Play is trying to come in with some interventions, and I think going forward, I may have the opportunity to share with you. So Susan, this is the case in Ghana. Thank you.
Thanks, Lawrence. Mallory, it would be interesting to hear from you if you could share with us some of the circumstances that our Indigenous partners are facing in their communities.
Thanks, Susan. Yeah, I can share a bit of a brief background on what the 85 partners who are First Nation, Métis, and Inuit have been sharing with us. As I'm sure many folks who are calling in who are from Canada can appreciate that systemic issues that Indigenous communities face regularly become quite easily exacerbated by a crisis like COVID, especially as the need for resources required to mitigate impacts are heightened. So each community, each First Nation really has been implementing a unique pandemic plan that is taking into consideration some of the specific resources and challenges in that locale that they're facing. And in an effort to implement these plans, as well as regional emergency plans, Indigenous Services Canada is working along with many First Nations, Indigenous organizations, as well as provincial and territorial governments to help coordinate some of those intervention and emergency health services. Unfortunately, over the past 2 weeks, we are seeing quite an increase in terms of COVID positive cases in First Nations. As of April 24th, Indigenous Services Canada was reporting 95 confirmed cases across multiple provinces. And we have had about 4 Right to Play program partners share with us that they have confirmed cases. So in those response plans that communities are implementing, those emergency response plans, you see a lot of similarities to what municipalities are doing. So everything but essential services are typically shut down, with a strong focus on ensuring that water, food, fuel, and medical care continues to be provided. So it looks unique in different places, but a lot of communities have been implementing home or curbside grocery delivery, medical care transportation, and a lot of wellness checks for individuals. Some communities are also on full lockdown, so preventing exiting or entering into the community unless for medical care, and many have curfews in place. And really, in overall effort to implement these plans, there's been a lot of redeployment of community members and staff from one portfolio to another. So for example, the youth worker community mentor, Right to Play program community mentor in Six Nations is now doing both food delivery as well as modified youth programming in order to best serve the community members.
Wow, that's interesting. We'll look forward to getting back to you in a couple minutes so you can give us a little bit more detail on what the community mentors are doing in their communities. For now, I'm actually going to turn to Kevin and ask you to share with those on the call how our program teams are currently responding to the circumstances that we find ourselves in right now.
Sure. So we have a 3-pronged strategy, our COVID response strategy. The specifics vary a little bit country to country, but the broad priorities are all the same. The first, not surprising, is keeping children safe and healthy. So protecting the children in our programs is our #1 priority. As I mentioned earlier, due to the insufficient healthcare, economic realities, population densities, the only realistic strategy is prevention. Treatment really isn't a viable option. And disease prevention is actually something Right to Play has been doing for 20 years. We've been teaching children how to, for example, use mosquito nets to protect themselves from malaria, how to properly use condoms to prevent sexually transmitted diseases. And for 20 years, we've actually been teaching children how to properly wash their hands to prevent communicable diseases like diarrhea, which is a major killer of children in Africa. So in this COVID crisis, we're using all of our past experience to teach children, their families, and their communities effective hand washing and social distancing. Our intervention is literally going to be saving lives in the countries where we work. The second prong of our strategy is to keep children learning. 1.3 billion children are out of school right now around the world. And as I mentioned before, there's only one country where we operate where schools are still operating. So what we're doing is using child-friendly distant education methods. We're using TV, radio, online learning to reach children where they are in the home. Recently in Lebanon, we've just put out a program via Puzzle TV, which is actually reaching 5 million children in 41 countries with playful television educational programs. And I just heard over the weekend that in Mozambique, the Ministry of Education selected Right to Play as its partner to develop a daily educational TV show that will be shown nationally to reach children across the country with playful learning, pedagogy, and games. The third prong of our strategy is to keep children mentally strong. So we're committed to strengthening children's psychosocial well-being, both now and maybe more importantly, after the pandemic. We have 20 years of experience working with children in conflict-affected areas, whether that's war zones, after natural disasters, or in the face of disease pandemics. We know the psychological and emotional toll that these crises take on children. So currently, we're distributing 30 specific psychosocial support activities to children and their parents. And again, we're using radio, TV, WhatsApp. We're including short videos about how parents can help to maintain and build their children's psychosocial health during the crisis.
Amazing. It's pretty phenomenal to hear of all the different platforms that we're using in the different countries where there's different contexts in terms of how we can share the information. Kevin, I bet the people on the line would be interested to hear about Right to Play's experience in a previous very significant health challenge the world found itself in back in 2014.
Yeah, the Ebola crisis in West Africa from 2014, I think, is a really useful example of Right to Play's experience in a pandemic like this. Similar to the coronavirus, Ebola is a highly contagious virus spread primarily through human contact. And a few weeks ago, just as this coronavirus hysteria was really starting to amplify, a colleague from Right to Play forwarded me a manual from Right to Play from 2014. This is a whole bunch of educational activities, play-based activities that parents and teachers could use with children. We developed it with the Ministry of Health and Social Welfare in Liberia. And I was really surprised. There was 5 chapters in the manual, and one of the chapters was entirely dedicated to social distancing. I, of course, thought social distancing was a relatively new word that had just come out of this COVID crisis. But in fact, Right to Play has been doing social distancing since at least 2014 with children. And the chapter right before the social distancing chapter was called Hand Washing and Hygiene. And again, it was a whole set of 10 different activities, educational programs to help children learn how to wash their hands effectively. So Right to Play's methodology over the last 20 years has been proven to deliver exceptional results in 2 key areas: knowledge acquisition. So our methodology really helps children learn and retain what they've learned. And then secondly, to change their behavior. And I think in this case, in this crisis, similar to Liberia in 2014, that knowledge acquisition and behavior change around hand washing and social distancing really has the potential to save lives. And we're using everything that we learned in 2014 to inform our response now in the coronavirus. I would also say that, while we really focused on health in Liberia, we did a significant amount of work after the pandemic on psychosocial support to help children recover from trauma of the crisis. And what we did is we actually we distributed via nationwide radio broadcasts a bunch of activities to build children's psychosocial resilience.
Wow, amazing. It doesn't seem like Ebola was so long ago, and yet here we are 6 years later in a very different but somewhat similar situation. So it's good to know that Right to Plays can be recycling to some extent some of the content that was put together back then. Lawrence, in Ghana, with the schools being closed and the diversity of the population, we're wondering what's happening there and what's your plan to try to get to ensure the kids are healthy and safe?
Yeah, thank you, Susan. I think basically we are looking at the situation based on the fact that children in rural Ghana and mostly are not having access to the online programs that exist. Most of them are also under some form of trauma because of the various diluted and then the misinformation that is going on around. And so first and foremost, our program is addressing, one, to ensure that we provide some form of psychosocial support to children in the communities where we work. And we are doing this with teacher volunteers and youth groups who are ready to reach out to the communities, engage with children and families, and then provide them with some clear information and then helplines to use in case they have any challenge. The main thing is to demystify the various kind of misinformation that they have. Apart from that, we are also looking at putting in place some support in terms of practicing hand washing. And so through play, we are trying to make sure that these teachers reach out to the family, get them to be active, get them to be healthy, and make sure they stay strong and be able to withstand the issues that comes with the crisis. Another aspect of our engagement has to do with how we are able to support learning in the absence of schooling. So we are providing alternative learning situations for our children. And this we are also doing together with our volunteer teachers. First and foremost, we are providing online training for those who can access our programs and games and activities. And then we are also engaging with the teachers by providing them with PPEs, hand gloves, and making sure they are trained to know exactly how to enter into the homes and visit homes and engage them, the children and families. Our key thing is to promote home learning and how parents are going to be supporting their children at home. So not only are they going as they go into their homes, they go with learning materials. We are giving storybooks, though not enough. We are rationing it, but we're providing storybooks, we're providing learning materials, and other activities that children can learn. We're also encouraging these teachers to use the workbooks and give them assignments that they could come back later and look at it. One of the key things we've realized, which is a problem in our communities, is the fact that there's a problem with access to water. And so if we're talking about washing of hands, most of the times we have issues with having potable water to drink, especially during the season in which we find ourselves, the dry season. And so we are encouraging the teachers to motivate families to establish TP tabs, and we are providing cakes of soap to the families so that we, in our way, we want to motivate them to practice hand washing and at the same time make them be able to have access to alternative learning opportunities. In order that by the time school is reopening, they wouldn't be losing track of whatever that they have to be doing until they return. So this is basically our kind of intervention here in Ghana.
Wow, super creative. And, clearly you've got to do a whole bunch of different things, both in the urban and rural settings.
Yeah.
Mallory, I wonder if you could share with us how our program is changing in our partnerships with Indigenous communities and what you're seeing happening, how the role of our community mentors who are based in the communities, how their role is changing or possibly staying the same. Over to you.
Yeah, so the community mentors, as Susan said, they're the frontline youth workers who are delivering play programming in the communities that they live and work in. And I'm really happy to share that today over 75 community partners are delivering modified programming. So they're reaching children and youth regularly throughout the week with programs. Our team has continued to provide the community mentors, those frontline folks, coaching and training support around how to launch and lead virtual programs. So how do you basically take something that was in person and experiential and lead it virtually? And how do you ensure that those learning outcomes that you were previously working towards still continue or change based on the times of COVID? So we've continued to provide consistent outreach through phone calls and networking, community of practice. And then we're also providing some activities on a weekly basis that have been adapted to be played in the home and with the family. So we've taken a lot of our activities and really rewritten them and restructured them so that they can use in-home materials, they're accessible to all ages, they can engage family members, and they continue to educate and engage community members in safe COVID practices, psychosocial well-being, physical fitness, education, and leadership learning. I think the best way to probably share what's happening in community is to give a few examples. So the work the community mentors are doing is, as always, so creative and playful and really responsive to the young people that they support. So I've got two mini stories I can share. In Hamilton, Vanessa, the community mentor Vanessa, is leading programs every night, Monday to Friday, that have a mixture of life skill building along with cultural teaching. So she's led some really cool virtual nutrition bingo, virtual smudges, and role modeled and taught kids how to properly wash their hands. And similarly, Tori, who's the community mentor in Beausoleil First Nation, has a weekly schedule for her youth group that mirrors the schedule that she had, the program schedule pre-COVID. And so on Monday nights, they take part in self-care activities, as well plan leadership initiatives that they can coordinate to build community while everybody is at home isolating and social distancing. And then she also has an art night, a fitness night, an education night, and caps the week with a Friday fun night. And she serves youth in high school, so a lot of grade 9, 10, 11s, and is really helping to build that kind of peer network. And being the brilliant youth worker that she is, Tori creates a weekly bin of the supplies for the activities and does a weekly drop off on Mondays so that all the participants have all of the materials they can or they need in order to show up every Monday to Friday to enjoy and play and learn together.
Wow, Tori's a rock star. I feel like Friday fun night would be good for my family, but I'm sure it's not eligible for all of us. I saw a video of one of the community mentors who was putting together a weekly cardboard box for families in his community that looked fantastic. So it's pretty amazing how dedicated and creative these community mentors are. So thanks for sharing. It's certainly a really impressive group. I'm actually going to switch gears here and start the conversation around the aftermath of COVID-19. Kevin, what challenges do you foresee, and how is Right to Play going to mitigate these challenges? Do you picture there being a longer term impact on our approach to programming post COVID-19?
So I think that this pandemic is going to be around for a long time, especially in the communities where we work. Because if we take an optimistic scenario whereby there's a vaccine in the next 18 months, it's going to be a very long time after that the children in our programs in the countries where we work are likely to receive that vaccine. So until then, the communities are going to be living with the effects of this virus as it moves through their communities. And I think that's going to be at least several years realistically until children in the places where we work receive a vaccination. So for the reasons I listed earlier, I think kids are going to be going back to school pretty soon. Certainly long before this virus is defeated in their communities. So as I see our response shifting, I actually see it moving from immediate interventions right now that are more focused on reaching children at home by their parents or through radio, TV, WhatsApp. I do think that very soon we're going to be reaching children again via teachers in schools, which is where the majority of Right to Play's work traditionally happens. We have very strong relationships with ministries of education. We do a lot of work on national curriculums and national teacher training. So I do think that we will start to reach children using kind of a different distribution channel. It will move from the home to teachers, but I actually think that our three-pronged strategy, the three priorities, the three focuses that I spoke about a little bit earlier are going to stay exactly the same for the foreseeable future, and I would say that that's going to be at least several years. The first is going to be keeping children safe and healthy through disease prevention. So in these schools, which are crowded, where there are a lot of children, we're going to continue to start to teach them about social distancing and hand washing. We're going to ensure that they're getting a quality education by training the teachers there. So make sure that we're keeping children learning. And then thirdly, as the effects of this virus really start to scale up in the communities, we're going to be focused on keeping these children mentally strong by providing psychosocial support from the teachers in the school and the community coaches that we work with. And I actually feel really confident staying with this COVID response strategy over the medium, even to long term, because it aligns so well with Right to Play's overall mission. which is to protect, to educate, and to empower the world's most vulnerable children. In answer to your second question, you said, how is this going to potentially change our programming going forward? I'm not sure, to be honest, but I'll tell you one thing that's becoming obvious early here is that the scale that you can get through sometimes TV and radio is one of the most prevalent means to reach children, may start to show up more and more in what we do going forward. We've had a bunch of partnerships like the one I talked about with the Ministry of Education in Mozambique, in Lebanon, where we're finding out that we can use TV and radio to reach a lot of children. So I don't know what that would look like. It's way too early. We're kind of in a strategic planning process right now, but I wouldn't be surprised to see TV, radio emerge as a more prevalent distribution channel for us going forward.
That's pretty interesting. It'll be cool to see how it all unfolds. Lawrence, I had an opportunity to see an amazing video from Ghana of kids singing about hand washing to prevent the spread of coronavirus. We're going to be sharing the link to this video after the call with our listeners, but I wonder if you wouldn't mind giving them a bit of context regarding the video and how it came about.
Yes, so this video was taken by one of our coaches, Duke, in the northern part of Ghana. And this was the initial response when we started engaging children in activities, hand washing activities, to make sure they stay safe. And so the enthusiasm you see in the video is exactly what the teachers are doing now on the ground. They put the children together, come up with a kind of song that the children could relate to, attach some form of movement, so that as they practice this movement and sing, it makes it easier for the communities who listen and the people. And this is now viral across all over Ghana. Everybody is playing it. And then apart from the fun and then the joy you get in listening, people are learning as to what exactly to do to prevent and save themselves from the infection of COVID-19. So basically, this is one of the ways that our teachers are getting involved with the children in the communities as they are engaging with them in the communities where we work.
Well, I'm looking forward to everyone having a chance to watch it because it's certainly a pretty fun video. And I think I was on a call with Kevin Frey a couple of weeks back when he reported that his 3 kids have been singing it morning, day, and night. So maybe the jingle will get caught in a few other people's heads.
Yeah, be forewarned, anyone who does show this little video to their kids, expect the coronavirus song to be sung around your house for the next week. So you've been warned.
You know what? Families that sing together stay together. So that's all. People are looking for entertainment. Mallory, on the subject of entertainment for parents and families, I wonder if you could share with everyone what other resources Right to Play has available for those that are in their homes with their kids and trying to keep things engaging.
Yeah, I feel like my sister has turned to me many times. She has 2 young kids, and I've been sharing all of my tips and tricks around how to play games in the home over the last month and some. And so Right to Play on our website, we have a games resource page that's been being updated every week with new games. And so there's games around a whole different variety of learnings around the importance of hand washing, how to cope with physical distancing, how to keep kids active and learning at home. So beyond program participants, for everybody on the call, for your family and friends, please feel free to use those activities. I know it's many conversations we're having as well in our homes, so we hope you can access those.
Thanks, Mallory. There's a math game that we've been playing lots in my house that we got off the Right to Play website. Before I open it up for questions from our callers, I really want to thank everyone for taking the time for joining us this afternoon and listening to the conversation. But thank you also for your amazingly generous support during this time. It is actually support from our donors that enables us to continue our mission to keep kids protected, educated, and empowered. Without your support, our programs just wouldn't be possible. And particularly during this challenging time when we are needing to rethink how we deliver our programs effectively and reach children in new ways. We rely on our donors now more than ever to support our new programs and diminish the long-term impact of COVID-19. If you happen to be on the line and are not yet a donor or possibly are a donor that wants to consider making a top-up gift during this critical time, please visit our website at www.righttoplay.com to make your contribution. So I am now going to facilitate hopefully some questions and answers via the chat box. So if there's anything that you're curious about that you haven't had a chance or that you haven't heard any of our panelists speak to, please share a chat with us. So I've got a question for Lawrence, which is, what's a tippy tap?
All right, so tippy tap is a local kind of water dispenser where you either fill a gallon with water, and then this is hanged on two poles, and so you tie a rope to it. So once you press on the rope down, the gallon automatically goes up and then dispense the water. And so you don't have to use maybe a cup or have to fetch the water and pouring it on your hands at the same time, particularly when we are encouraging people to wash their hands under running water. And so this is a kind of a system we've created. It's a locally made. We use gallons or we use containers in doing these things for schools and families and in their communities to use in washing their hands.
Great, thank you. Kevin, there's a question here from Kelly wondering how she might access more information about the 2014 response to Ebola.
Yeah, we can definitely follow up. Thanks, Kelly. I'm happy to share, the more folks who get those resources into their hands, hopefully the more lives we can save. So we'll definitely follow up after the call with you and make sure that you get some of those materials.
There's another question here from Sam, which is, he's wondering, I think Sam's actually one of our athlete ambassadors, so thank you, Sam. Wondering if there's other ways we're going to utilize our athlete ambassadors to reach children both locally and internationally. I'll give you a little bit of an answer, but I think Kevin might be able to build on that as well. We are planning to have a few more play breaks that we're inviting donors, and that'll likely be on our social media channels. So there will be an opportunity for athlete ambassadors there. We also have the CEO of Facebook on our board, Garrick, and he's keen to see what we can do in terms of engaging our athlete ambassadors on Facebook. But Kevin, do you want to add anything to that?
No, I think we're hopeful that we'll have some interesting content coming out via Facebook, Instagram platform at some point in the not too distant future. I know we had Pascal Siakam push something out last week, which was great, really both talking about the importance of hand washing and supporting organizations like Right to Play. So that was great. And some of the other countries where we operate, in the UK, in Norway, we've used athlete ambassadors. Actually, there was a television program in Norway that aired for, I think, 3 weeks, 1 hour a day, where they were all doing kind of training and making training available. So it was kind of in-house exercise. And then we were able to talk about Right to Play, but the point of everyone coming on this national TV program was to be able to exercise in their house. So there's lots of creative ideas out there, but Sam, would love to hear if you had any ideas as well. What we want to do is engage Canadians, engage our supporters to, number one, get some of these really important messages out, and then two, just to get the message about what Right to Play is doing around the world.
Thanks, Kevin. We've got a question from our friend Kendra Kerr at MLSE, and I'm going to actually ask Mallory to respond first, but I bet Kevin would also have some ideas, and maybe Lawrence as well. And Kendra's question is, how are we navigating child protection for youth who are going virtually to attend programs? So why don't I start with you, Mallory?
Yeah, I'm sure many people who also have kids at home have been wondering. There's been, at least in Canada, also a lot of news around the safety of young people as more and more kids are spending more time online. So child safety and child protection is really important and critical for us to consider at this time. Within the Play program, one fast initiative that we did was distribute child safeguarding guidelines for all of the frontline youth workers, and we're doing training for those folks to understand what virtual safe programming can and should look like, and providing training and coaching so that they know how to navigate that and set themselves as well as young people up for safety and success in those spaces. The second thing that we've been doing is in Canada, there's a coalition being led by the Government of Canada, the Canadian Women's Foundation, as well as the Canadian Teachers Federation, and it's called the Safe Kids Initiative. So we are a part of that coalition, and it's looking at three main issues that they're seeing around vulnerable populations in Canada due to COVID, being food insecurity, connectivity, and gender-based violence. And in the Connectivity Coalition Working Group, we're exploring what the best pan-Canadian approach will be to ensure that young people are protected and being safe when engaging in all of the virtual and online learning. So working on that coalition to also see what we can do to continue to enhance the safety of young people.
Thanks, Mallory. Lawrence, is that something that you're trying to navigate in Ghana as well?
Yes, it has to do with how children are protected. And what we're doing basically is to ensure that the children we're reaching are not directly having access to the various platforms through which we are sharing most of these materials. First and foremost, we are engaging the parents. And so most of what the children receive is whatever has been shared from our volunteers onto the gadgets that these children are going to use. Maybe the good thing that is helping us is the fact that there isn't so much availability of the computers and the internet so that they could go online and begin to go beyond what we have shared. And so there's some form of regulation in whatever the children have access to. The next thing is the teachers who are going. We have restricted what time they need to go into the family, into the homes. We have you have a limit to what time you can engage with parents, what time you should go into the family or go into a home and engage them. At what point, what should be the distance when you are engaging the child? So all these gender, child protection issues have been taken into consideration in most of the trainings that we have done already with our teachers virtually. And I think so far, the feedback from the field has been very positive. Most of the youth are giving materials and they are reporting back to their teachers on whatever they are doing. So children have limited access to most of the gadgets that will let them have access to some of these abuses.
Okay. Kevin, is there anything you wanted to add in terms of navigating child protection? I'm sure you're hearing lots of different countries.
Yeah, I mean, globally, I think what's most important is just our model. So how we end up reaching children is via parents, coaches, teachers. So even when we're responding in this crisis, we're doing it via parents, via teachers, via coaches, we're essentially providing with materials to engage these children. So we don't have that direct interface with the children, which significantly lowers our risk. And obviously TV radio is kind of a one-way communication, so we don't have the same child safety, child protection issues. So our model is a relatively low risk model because of how we engage.
Got it. Kevin, I've got a question for you, and I'm wondering whether this could be a donor, a Canadian Advisory Board member, but people want to know, what are you most worried about in the short and the long term?
Well, certainly I think, you'll know this, Susan, because I think it's probably the same thing that worries you, is a significant fundraising channel has dried up a little bit for us in that events, right? So we do a lot of our fundraising via events. And as of right now, those events are unlikely to happen this year. So I think that puts a little bit of pressure on the organization. So I think that risk remains present going forward. But what I'm most concerned about programmatically, and you see this even in the global north, but far less, this is a huge risk in many of the communities where we work, is now that kids are out of school, and you heard Lawrence say that many of these parents are taking the kids to work with them or sending them out to work. I know I've talking to Lawrence a couple of weeks ago, and he told me, some parents are even using this as a holiday where they stop working and they're sending their kids to go do the work. Because the kids aren't at school. There's a real chance that structurally, once these kids drop out of school, they won't go back. Mm-hmm. There's not a strong system in place to make sure that kids are getting back into school, and there's lots of economic incentives for parents to keep their kids out of school. So my biggest worry is that if this out of school period extends much longer, that you'll actually see a significantly higher dropout rate in many of these countries because of the crisis.
Yeah, that is, I know how hard all our country teams work to keep the kids in school. And so new behaviors of having kids involved in work could be tough for some families to break, for sure. Mallory, we had a question earlier on from someone interested in how the community mentors are accessing technology differently and how the Right to Play staff are supporting those community mentors now that they're not allowed to go in to community.
Yeah, great question. So I think the technology and connection is a challenge across every country that Right to Play works in, and our program included, because we have a number of remote and fairly isolated community partners that don't have widespread internet access, and folks in their homes don't necessarily have devices for every child, every youth, or every adult. So we're really taking that on a one-to-one conversation to understand what resources are available in community. We have been, as I mentioned, providing a lot of activities and resources that the young people don't need access to devices to play, so it's not just virtually run programming. Some community mentors and some communities in their crisis response plans have also been loaning out devices so that young people can have access to the supports that they need. So there have been some devices that have gone on loan out to young people. And then similarly, a lot of community mentors, I know I said Tori is dropping off bins, but a lot of community mentors have been really doing drop-offs of activities and resources and supplies to homes, or for anybody who's traveled to First Nations, to the northern store, which is where the groceries are. And when families do their weekly pickup, they also include the activity bundles for the week of activities within the grocery store pickup. So everybody's been kind of dabbling with it in different ways to work around the fact and ensure that young people without access to internet and devices are not being left out of programming.
Great, amazing. We are not getting any more questions from our callers, so either you guys covered absolutely everything you could have, or people have had enough information, I'm not sure which. I wonder if there's anything anyone, any of Lawrence, Kevin, or Mallory would like to close with before we send people on their way.
I think just to say thank you for spending a little bit of time to hear about what Right to Play is doing, the impact that we're trying to have. I think it's a bit of an unforgotten or unspoken about crisis in the global south right now. We are, for lots of obvious reasons, because the crisis is in our backyard, very focused on what's happening in our backyard. But I think, as I open with, and as I mentioned, Bill Gates was saying on CNN yesterday, in all likelihood, when all is said and done, the damage that this pandemic does in the global south will far outweigh anything that's happening in the places where we are. So it's really important to keep in our consciousness, in our minds, the children, the families, and the communities who don't have access to the resources that we have as this virus starts to gain momentum there. So thanks for taking a little bit of time to spend with us and hear about the situation that those families find themselves in.
Thank you, everybody.
Thanks, everyone. Well, thank you, Lawrence. It's much later in the day in Ghana than it is here in Toronto, but thank you very much, everybody. We will follow up with Kelly with some information from Ebola, and everybody on the call will receive an email from us where you can give us a little bit of feedback. And if you have any questions that come to mind that you want some more information from us, don't hesitate to ask. But thank you very, very much for your ongoing support of our work. It really is having a tremendous impact on people's lives. And I think as Kevin and others have noted, this pandemic is going to be even that much more serious in some of the communities, whether they're in the Canada's north or in the global south. And we're so grateful for your support so that we can continue to engage with the young people. So thank you very much. And everybody enjoy that sunshine if you're in Southern Ontario. Thanks.
Thanks, folks.